By adopting even one change to a healthcare business practice, some experts believe lives can be saved. How about 5 million of them? Welcome to ReachMD XM157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and with me today is Toni Mills, who's the executive director of the Office of Clinical Affairs for the Blue Cross and Blue Shield Association. In her role, she handles the Office of Clinical Affairs for a national federation of 39 independent, locally operated Blue Cross and Blue Shield companies. As executive director, she is responsible for the programmatic leadership for activities that include initiatives to improve patient safety for the 39 plans, as well as working on new relationships with quality and physician organizations to ensure operational excellence. Before coming to Blue Cross and Blue Shield Association, she held various positions at CNA Insurance and United States Life Insurance Company, responsible for everything from operations for financial reporting to claims utilization review. Please welcome Toni Mills to ReachMD XM157, the channel for medical professionals. So good to have you here.
Thank you.
Well, if you could just go into telling us about this campaign that Blue Cross and Blue Shield Association is involved in that centers largely around patient safety, but if you could just go ahead and take it from the top.
Okay. Well, the Institute for Healthcare Improvement, IHI, had started this campaign for 5 million lives as a national campaign to dramatically reduce incidents of medical harm in the U.S. hospitals. And the aim of the 5 Million Lives campaign is to support the improvement of medical care in the U.S., significantly reducing current levels of morbidity, illness, and medical harm such as like adverse drug events or surgical complications and mortality. IHI has quantified this aim and set a numeric goal. They're asking hospitals to participate in the campaign to prevent 5 million incidents of medical harm over the next 2 years. This campaign actually started in 2006, so it's running for the year 2007 and 2008, and their goal was to enroll 4,000 hospitals, and actually that milestone was reached this month. We actually have 4,000 hospitals that have signed up and committed to the IHI campaign.
And if you could you tell us, the IHI is actually a separate organization?
Yes, the Institute for Healthcare Improvement, in addition to certainly supporting these types of campaigns, does research and academic types of initiatives, commitments to quality. They look at medical type continuum of care. They actually are starting a school right now for professional students, medical students who will actually learn about patient safety. The campaign is just one small part of their institute, and that campaign is what the Blue Cross Blue Shield Association underwrote the 5 Million Lives campaign with $5 million contribution to support this effort for the hospital nationwide to transform the quality of health care and the way it's delivered.
And I guess if you're talking about such a milestone, when you're talking about patient safety, for our listeners out there, to get 4,000 hospitals to agree on anything is significant. And if you could tell us exactly what is it they're going to be doing to save these lives.
If you look at medical harm throughout the United States, the IHI research collaborated by academic colleagues suggests there are between 40 and 50 incidents of medical harm to patients for every 100 admissions. So that's with roughly 37 million admissions per year in the United States. That means approximately 15 million incidents of harm per year in the United States, which translates to 40 million incidents of harm each day. And so what they would like to do is try and eliminate or reduce the national harm by about 17%, which was what the 5 million number they came to. And when we look at the kinds of interventions that they're looking at, they previously also had a campaign for 100,000 lives, and that was saving 100,000 lives. And the six interventions for those campaigns are, one, let's talk about a deployment of rapid response teams. This is at the first sign of a patient decline and before a catastrophic cardiac or respiratory event. This team goes into action, and it takes a lot of work to coordinate that. And they have toolkits, and they have primers, and they have people who can teach in the hospitals what your team should be doing. They also look at delivering reliable, evidence-based care for acute myocardiac infarction to prevent deaths from heart attacks. In each one of these planks, they actually have primers, they have toolkits, they have people who can go out and teach. They want to prevent adverse drug reactions by reconciling patient medication at every transition point in care. How many drugs is this patient taking and what are the reactions that can happen? And sometimes that never happens. The patient doesn't come in with their little bag and say, here's all my medications, and a doctor prescribes another one. So they're trying to get medical reconciliation done at the hospital. They want to prevent central line infections by implementing a series of independent, scientifically grounded steps. So here again, the primer that will help these hospitals actually figure out what they need to do. Some very simple steps, some more complicated. All of this is available on their website, so you can actually, it's for free. There's nothing that they have to pay. They sponsor calls throughout the season. They have these mentor hospitals that will actually come and work with your hospital. They have board members that will come and work with the hospitals. Let me tell you about the other couple interventions they have. They want to prevent surgical site infections.
And could you plug that website, if you could, for our listeners if they wanted to write it down, and we'll mention it later again in the program?
Sure. The website is ihi.com, and go straight to that website, and you can get a wealth of information of what it is that they have, the toolkits that are available. They actually have some of the first 6 interventions in Spanish and in a number of other languages.
Well, if you're just joining us, or even if you're new to our channel, you're listening to ReachMD XM 157, the channel for medical professionals, and we're talking today with Toni Mills. She is an executive with the Blue Cross and Blue Shield Association. She comes to us from her offices in Chicago, where the association, which represents almost 40 of the nation's Blue Cross plans, they have sponsored and underwritten an interesting campaign with the Institute for Healthcare Improvement on a way to save 5 million lives. And that's a lot of lives, and we've heard a lot about patient safety and so forth. And if you could go into some more detail on this program, it's very interesting.
Okay. They also want to prevent ventilator-associated pneumonia by implementing, again, a series of interdependent, scientifically grounded steps. And again, you can get this material at the ihi.com website under the Materials tab. You'll find fully referenced literature that provides a foundation for each of the recommended interventions, along with success stories from practitioners who have led successful implementations.
And what are some of the interventions targeted at harm?
Well, there were the first 6 I mentioned, and now the other interventions we're also targeting is the prevention of MRSA infections.
Everybody knows as MRSA.
MRSA, right.
So I like it as a shorter name. The superbug, as we call it in some of our stories.
The superbug, as opposed to the longer name.
Exactly.
Reducing harm for high-loaded medications, starting with the focus on anticoagulants, sedatives, narcotics, and insulin. Reducing surgical complications by relying on implementing the changes in the care recommended by the Surgical Care Improvement Project. Preventing pressure ulcers by reliably using scientific-based guidelines for prevention of these serious and very common complications. Delivering reliable evidence-based care for congestive heart failure to reduce readmissions. That's one thing they don't want. Their last goal is really to get their boards on board, and this is really important, and what they've found is that when you have your board, you're defining your criteria, defining what is important to your hospital. By defining and spreading new and leveraged processes for hospital board of directors, they can become far more effective in accelerating the improvement of care. When the CEO and the board says this is what you do, that becomes the focus for your hospital, and I think that's what's really, really important in this campaign.
Given the fact that the 4,000 hospitals have signed on and agreed to this 5 Million Lives campaign through the Institute for Healthcare Improvement, are there some hospitals that are not doing this and are not addressing these approaches via teams and so forth, or are they addressing some of them, or are there any measures on that?
We are starting to measure some of what is specific data, hospital-specific data, including the information that is sent to IHI. In this campaign was really about awareness, and so it's not going to be publicly published at this point. With the permission of the hospitals, the campaign posts the name and the location of participating hospitals. They, include facilities, some kind of reports, but the IHI is actually going to measure and do a harm study towards the end of this campaign, and they've actually started right now. From the baseline of 206 to the conclusion of the campaign, they're going to look at the difference between expected and actual harm to give some harm avoidance measurement. Some hospitals are doing much more than others. When you commit, you don't have to commit to all 12 planks. You can commit to 1 or 2 or 3. You might be a hospital that's already done something really well, and you want to look at something that's not doing so well in your hospital, so it depends. There are also hospitals in the 4,000 hospitals that even Dr. Burke will say just signed up and didn't do anything. But what we have been trying to do, and what the Blues have been trying to do with their local hospitals, is actually put this information and make it part of their quality improvement. For example, Blue Cross of Illinois, they hosted the Chicago Patient Safety Forum for hospitals, and they also incorporated the 5 million lives into their hospital quality recognition standards. So you do have a number of plans that are incorporating into some of their quality recognition programs and getting some results from different hospitals.
And one of the significant things I noticed about this, and we're talking about efforts to save lives in hospitals, hospital safety, is that there's some heavy hitters backing this. Of course, you're with the Blue Cross and Blue Shield Association, but also the Joint Commission. And if you're a doctor out there and your hospital is not paying attention to these things, I mean, I'm sure that this would be something that the Joint Commission would consider when they come and evaluate hospitals, that, hey, they participated in an effort like this.
And that's true. And the Blue Cross Blue Shield Association, we have started recognizing these participating hospitals who have made this fully committed list on our website and our Doctor Hospital Finder. And so they do get the recognition. They're known as fully committed hospitals, and their generous contribution of time and efforts are integral to capturing the success of this campaign's efforts. And so we want to make sure, although 4,000 hospitals, and keep going strong, did sign up, we absolutely want to recognize those fully committed and work with those fully committed to help some of our other hospitals. When a rural hospital says, I can't get started, I don't know, that's not the case. I mean, even in Iowa, 100% of their hospitals have committed. And that's a very rural state, and 100% commit, and they get help from each other as to what's out there. I know in our Alabama plan, they actually also have 100%. They put a big ad in the newspaper for those hospitals, and they have a quarterly meeting of all of their hospitals. And now the hospitals are actually speaking up and saying, how did you prevent this, or what did you do for this intervention? So they're helping each other. They're not competing. They're competing on other things and not patient safety. Patient safety is way too important to be competing.
Well, with that, I'd like to thank Toni Mills, who's been our guest. She's the Executive Director of the Office of Clinical Affairs for the Blue Cross and Blue Shield Association, which is involved in a big way in a campaign called 5 Million Lives. And you can find out more about this patient safety program at Institute for Healthcare Improvement. Their website is IHI.com. I'm Bruce Japsen of the Chicago Tribune. I've been your host, and you've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. If you have comments or suggestions about today's show, please call us at 888-MD XM 157, and I'd like to thank you today for listening.